Good afternoon. Would you
Good
please let
afternoon.
everyone know where you come from and which condition brought you to our clinic?
I am from Perth, Western Australia, and the condition that I have that brought me here is hypophosphatasia. Do you want me to explain more?
A little bit, yes.
So hypophosphatasia is like a metabolic bone condition that causes like weak bones and fractures and bone pain and muscle joint pain as well. And so I've had that for a long time, but quite recently had the diagnosis confirmed. And essentially there's nothing that really can be done in the Western medicine space. And so luckily I have a great doctor who is Robbie Simons, who I know that has some connection to this clinic. And he was the first doctor that was a little bit positive about what I might be able to do. And then I looked into this and had some meetings, and it's not necessarily the answer to like fixing the problem, but it's just supporting really my system in being able to function a bit better.
I see.
Yeah.
So as far as I understood, your condition started to interfere into your everyday life recently, like more and more.
Yes.
Like in which way has it already affected your daily routine?
Joint pain that sort of gets worse as the day goes on, and aching bones. I'm quite an active person. I used to be a swimmer, like quite an elite level swimmer. So movement and doing stuff like that is really important to me. And so keeping fit and being able to move is like priority for me. And that felt like it started to get affected a little bit by pain.
Have you got some treatments? Like, are you on any kind of medication to help you to cope with this pain?
I do so much in terms of body work and meditation and Pilates, and swimming helps, and so I really have tried to avoid going down the pain medication route as much as I can. But yes, I do have that if I need it. But part of the reason I came here was to avoid going down the sort of because that was the option that my endocrinologists have given me, is like, we can send you to a pain clinic, and that just didn't feel like the way forward for me.
It's the easiest way, and it's the last option, I assume, for
Absolutely.
you, right? Yeah.
And I know from a mental health perspective it's not the greatest option.
You're right.
For me. So
I see. So
yeah.
Before coming to our clinic, have you had any fears about what will be happening, how you will be treated here? Like, and if you had, what helped you to overcome those fears?
I don't think I didn't have any fears, weirdly. Like, it was a really interesting experience for me. I knew when I did a little bit of reading into the clinic, I just had this feeling that this is the right thing that I need to go to, and it was like not even it wasn't. I just got myself here, like I felt heard, and yeah, quite a different experience to other medical appointments that I'd had. So my fears were low, and even coming from Australia, like it was fine. Yeah.
How do you find the city? You had a chance to go out there. I mean, not many Australians have a chance to find out about our country, to travel here, not talking about that yet, traveling. So you are here, you are a tourist for a medical reason. How do you see the city? Is it safe to be? Is it nice?
That was probably the biggest fear.
Yeah.
The biggest fear for me was when I heard the clinic was in Serbia. It was not so much the treatment. It was like, oh my goodness, Serbia? Like, is it going to be okay? But it's so safe. Like, I went for a walk the other evening because it gets dark early. And it was dark with my daughter, and we felt so safe. There's women walking around. And then I heard it was one of the safest places in Europe, or
quite safe.
It has felt very safe, and we're staying in a beautiful location.
A couple of words about our doctors, about the nurses and the physio staff. I know you had some physio. Yeah. Do you think they're educated enough to perform these kind of procedures? A bit of feedback about it.
Yeah, my experience has been very positive in that way. Everyone has felt like they've really listened and sort of understood me and heard my story. Nothing's felt too much. I'm not particularly good at asking for help, but everyone seems to like just be there. Every time my machine stops, like, and beeps, someone's there to help. So, like, yeah, really lovely, supportive team in every department that I've been in. Yeah.
I know you are staying in the city, you're not staying in our facility, but you had a chance of trying our food. Couple of words for those who are serving in the restaurant.
Yeah, I'm a dietitian, so nutrition is like one of my, I guess, passions.
Okay.
And so delicious, real like good quality. They're lovely. Nothing again feels too much. Even with a bit of a language barrier, I still feel like they've, you know, really tried to do what they can to support what you need. So yeah, very positive feedback there too.
Okay. So stem cell therapy is the therapy when you see results, the results are postponed, like after 2-3 months.
Yeah.
Which results are you hoping for? Apart from the pain, you want to reduce the pain. This was the one, the one result you're expecting to have. What else?
Bone density. I've got, like, that one of the things is I've got quite low bone density for a 40-year-old, so that's something that I'm hoping improves. Just functioning better, feeling better.
I mean, the general state, I think it interferes with your everyday, like, routine, like feeling tired probably, yeah?
Yeah.
And then you have to be cautious all the time.
Tension and
Did
just
you have
worrying,
worrying
about how I'm going to cope with things. And yeah.
I see.
Yeah.
Oh, you're a sportsman. Did you have your bones broken many times during life?
Well, I'm a swimmer, so swimmers obviously are just in water, which I think is part of the issue with my bones too, having not been a land mammal. The most recent thing, I fell over when I was running and had a fracture in my knee, and that was what picked up this originally.
Yeah, like
so
when the time goes by and you get older, those fractures are more and more difficult
likely, absolutely,
to heal, right? So
yes.
to reduce the amount of possible injuries, right?
Yeah.
Yeah. It would reduce, definitely.
Yes.
Okay. The last question, would you please give a piece of advice, being already our patient, to the others sitting over there thinking, looking for some alternative ways of treating themselves? How should they advise? So you went for it, you know, you went for it and now you're here. What should they do?
I would say don't overthink it. Like, if it feels like the right thing to do, make it happen. Like, the cost is a big factor in all of this, like, and for us it was a big factor, but I think health is such an important part of its priority, and if you don't have your health, it means everything, doesn't it? So
life
I think
doesn't worth anything.
Yeah,
correct?
Exactly.
If there is no health, what else?
What else
to live
is
for?
there? So when you view it in that perspective, I think it's everything. So do it and don't think too much about it. Yeah.
Sometimes people,
make the
when
call.
they start overthinking, they start.
Yep.
And again, not only the money, but the distance. It's a long, long distance, right? Australia, Perth,
yes,
and Europe.
But again, you can make it happen if you want it enough, I think, and that's the same with everything, isn't it? Really? Yeah.
Did I understood correct? You're here with a family, with a whole family, with your kids.
Yes.
And you came from Europe. Does it mean that you had some trip around Europe?
Yes, so my brother is in the UK at the moment.
Ah, your brother.
Yeah, so we went and saw him, and then travelled around. We went to Italy and Paris, and then Switzerland for a bit, and then came here. So we made a bit of a holiday of it, and my kids have had this term off school. So they're stoked.
It's all it's all
Yeah,
worked out perfectly. Yeah.
Yes, exactly.
You're here now taking care of your health,
Yes.
and you gave them some emotions, some experience, some traveling around Europe.
Yeah,
Right?
yeah.
Everyone gained from this.
Yes,
trip,
exactly,
right?
exactly.